Okay, I will call the Winnebago County Community meeting to order on Wednesday, February 4th, 2026, and the time is 2:00 p.m. I will do the roll call at this point. Mariana Abadi, present, and Drell Braggshaw. Dr. Copeland. Dr. Giardini. Dr. Gorski. Dick Kunert.
Present.
Tim Neighbors. Dr. Penny. Mohammed Yunus. And Jason Holcomb's with us as well. And the R1 staff. Okay, next on the agenda is public comment. We have two speakers, and if you would not mind using the podium, so you can be heard. The first one is, that's signed up. Hang on, I will get you, Joseph, probably mispronouncing your name.
Hello,
Yes.
I am Joseph Skaluka, the Continuum of Care Specialist with the City of Rockford Health and Human Services Department. I was with our agency delegation that came before you at the last meeting to discuss the federal notice of funding opportunity and have on clients and consumers. As discussed, the NOFO from the federal government has continued forward. Cases are still ongoing, but they are allowing us to apply based on last year's grant cycle stipulations. With the 30% permanent supportive housing that was discussed at the last meeting is not going to be implemented at this time. However, within the next few months, another release will come out for funding, of which we are considering that will possibly be implemented in that. We are current grantees for the IMPACT program, and actually I have a quick update for our clients served and the progress within that grant. Our goal was originally to work with 50 individuals in this grant. In less than 3/4, we have served 49 unique individuals. And since we've been providing outreach to the overnight cafe recently, the individuals that we've met there and are willing to engage with us. As well, all of our 8 transitional housing units have been occupied at this time. We are working with our first true move out, and we're hoping that their unit will be ready in the coming weeks. The progress that we've made is reflective of the support that we're given from this board and the half-cent sales tax approved by local voters. Thank you.
Very much. And next to speak, please.
Richard Hayes, a local community member, and I appreciate the opportunity to speak with you. My goal for speaking is to ask the board to consider expanding their evaluation of quality outcomes for the programs that you fund. The money spent on structure and procedures is well spent, but to my mind, the eventual goal is to demonstrate a significant improvement in the mental health outcomes of either the citizens or the community. And I know there's been quite a bit of confusion to actually measure, but I did notice an NIH bulletin of in April of last year where they were going to start funding programs to try to devise tools to evaluate outcomes. So I would hope that the board would consider, number one, for each of the applicants to ask them to provide some type of measurable for the program that they're proposing, and also ask them for a time frame in which to consider submitting results of those outcomes. And the second thing that I think would be worthwhile would be even consider contacting the NIH to see whether or not this community board could be part of some of the proposals that they're putting together to develop tools to measure community health. So, thank you.
Thank you very much. Okay, moving on to presentations. We do not have one today, but next is the monthly activity report. Jason, do you want to highlight?
Yes, I will make a couple of highlights. Some of this is more future-looking highlights. On your, in front of boards, we have a QR code for you for the last part of our kind of local data collection for the strategic plan, which is your review of the board's mission, vision, and values and principles. That's part of kind of a standard process as part of a strategic plan update. That should be the time to also review mission and all the other kind of corresponding elements. If we're ever, at any point feel that any of those things, that should be part of a strategic planning process. So we ask you to please complete those before, I guess, basically the next board meeting. And I will also send out a survey link should you wish to do that to your desktop computer. I think the QR code is, if you want to do it on your phone, we've set it up to be mobile friendly. You can do it on your phone, iPad, computer. It won't matter how you do it. Okay. Then the other thing is to do a brief update on the Miami workshop. We've had really positive response from the stakeholders that have been invited to that. We probably have a group of 20 to 25 that will be attending at the April workshop. So I think that will hopefully provide a lot of value for our community in general, and certainly some things for the board to look at for potential considerations of the future. And lastly, I have a save the date for you, which is May 14th. That is the day that the Building Bridges workshop that NAMI kind of plans, and we co-host with them for usually bring in a national speaker, and then also have all of the funded organizations with resource booths, so to speak, for the general community to come and learn about the programs and understand services, how they may connect to those services. So certainly encourage all board members to attend if you are able to. And can we say who the speaker is this year?
So it's Nora McInerney. So she has a really famous TED Talk called "We Don't Move from Grief, We Move Forward with It." So she talks about mental health and different kind of, more serious topics, but with a sense of humility and humor. And that's called "Thanks for Asking." So our theme this year is "How are you really?" And so the Building Bridges theme is "To Understanding" this year. So we'll be back at Embassy Suites. And there will be more events rolling out within the next coming weeks.
Thank you, Chelsea. Next, I'm going to need a motion for the January 2026 meeting minutes. Okay. Okay. Andrell, okay. Any discussion or corrections? Okay, hearing none. All those in favor, please say aye. Aye. Opposed, same sign. Okay. Moving into resolution 2026 X, the resolution authorizes funded programs, budget updates for program 4 to 6. We will need a motion for this, that we will approve the following updates to the funded programs, FY 4 to 6 budget as set forth. There is for Crusader Clinic, there is exchange. There's a lot of supporting documentation for the detail. It's all been sent to the board members. So basically the direct supplies will be increased by 5,000, and the contractual agreements will be decreased by 5,000. So obviously, there's no change in the budget except for line item funding. I will motion for approval. Terry, okay, and Mohammed, all right. Because this is money, I will do the roll call. Andrell Bradshaw. Dr. Copeland. Dr. Giardini.
Yes. Dr.
Dr. Gorski. Dick Cooner.
Yes.
Tim Neighbors. Jeff Nielsen.
Yes.
Dr. Penny. Mohammed James. Mariana Body, yes. Okay, moving on to the next item, which is Resolution 2026-XX. The resolution authorizes accelerator award contracts extension. So this particular amendment will describe funds. Oh, no, that's still with Crusader. I'm sorry. I have to move to the next resolution. It's here. All right. So this particular amendment approves the following updates to the work plan for stepping stones. And this is actually a current role, and it's slower than estimated to begin with. But actually, there's just a new, the due dates have been changed. So the estimated completion date is August, pardon me, let me go to this to explain it. Okay, so is this, did it start in 2024? Okay, so it will end in December. It will be at full capacity and 100% completed in December 2026. So there has been a pushback because it was new construction, and the architect's plan and various plans were different than first estimated. So this is for the group home for stepping, or no, this is for the building, right?
Can I add a comment about that?
Yeah, please.
So what this proposes to do is actually extend the contract to May 31st of 2027, which is the end of program year 6. When the Accelerator Award program was launched, it was the intent to expend those dollars in program year 4, 5, and 6. But the notice of funding dictated that each contract was for 2 years. There is precedent for one contract that was extended, and that was the SWAT program through the College of Medicine. That was brought to the full board for approval. So anything beyond 2 years to extend the contract would have to be a full board decision.
Thank you. Motion for the bill, Dr. Gorski and Dick Cooner. Okay. Again with the roll call. Oh, I guess I'll go back. Huh? No?
roll call.
Oh, okay. So all those in favor, please say aye. Opposed, same sign. Okay. And resolution, oh, we're done with the resolution. So we're moving into discussion items, a grassroots funding template, contract, and work plan. And we will not need a motion for this. But basically, we all received this agreement and the terms. So I think if there are any questions, this would be a good time to ask. Laid out, it was 11 pages, and yeah, I hope you all enjoyed reading. It was. So does anybody have any questions or concerns about the template? Grassroots.
Correct.
Yeah, that's the other note I wanted to make. This has already been reviewed by
Our attorney.
Attorney Quantz, and she's signed off on this version of it and the work plan, but she did suggest that we put it forth to the month. If there's any feedback, she can take a look at the recommended changes. And then the final version of it would be an attachment essentially to the March board meeting decisions for grassroots. And then that would allow for that contract to be entered for each awarded program.
Yes.
They would see this upon the decision.
Mhm.
And there's the actual program year start date for services is not till June. So there's a 3-month window of time to kind of work through that if there are any questions or clarifications needed by any of the agencies with whom we are.
Yeah.
It's not intended to be overly complicated or prescriptive or to be a burden or to be authoritative. It's really it's the baseline for it was the core program contracts, which we've gone through really 5 iterations now of some version of that contract. It was really taking that and modifying it for the grassroots programs, understanding that they are nonprofits with, in some cases, in most cases, less capacity and less backbone than the core program. So if anything, the requirements are intended to be less restrictive and more flexible for those organizations while still holding them accountable to the basics of what the board would require and what would be appropriate for the receipt and spending of public funds. Won't need a motion. It'll be part of the next board meeting packet.
Yes, right.
If for any reason though, you do have feedback beyond today's meeting, you're welcome to send that within the next week or two, and there'll still be time to review that and talk with legal counsel and make adjustments if needed.
No, that's quite all right. Okay, at this point, there are no other matters to be discussed, so.
I'd like to make a motion.
Second.
Those in favor, please say aye. Aye. Opposed, same sign.